Good evening, everyone. Thanks for joining us this evening. I'll just give it a couple of minutes to make sure that everybody gets the opportunity to join. Bang on 6 o'clock. Sometimes people have technical issues and what have you. Dion, are we struggling to let people in? Because I can see the world turning a little bit.
No, everyone
Okay.
is in. Just one person's getting admitted. That's just loading. Might be a connection issue their side. Everyone else is in.
Okay. Maybe it's my screen. Super. Well, let's make a start. So thank you to everyone for joining us tonight. My name's Tara Belcher. I'm the Clinical Director of Hitchin and Whitwell Primary Care Network, which is the 4 practices in Hitchin and Whitwell, and I'm a GP at Portmill Surgery. We've had a few different educational webinars over the last couple of years, and by far and away the best attended was one that we did on prostate cancer. And we know nationally that men tend to be not so great at looking after their health. And we thought this might be an opportunity to try and engage people and talk about men's health in a bit more detail. So we're really fortunate that we've got local partners, and EveryoneActive have very kindly stepped in to help us with this. So we're planning to run a series of 6 webinars, one a month for 6 months, focusing on men's health, and this is the first one. So this is going to be a talk about men's mental health this evening, and we've got Mark Keir with us today, who's the fitness manager at EveryoneActive, and he runs the Men's Health Club, which he'll tell us a little bit more about later. Mark's got a presentation for us, which we're expecting to take maybe half an hour, maybe a little bit longer, and that you can't put comments, but you can put questions and answers. If you look along the top of or along your the bar, there should be a little Q&A icon. If you press that, you can pop your questions, and at the end of Mark's talk, then we will certainly have time for questions. So without any further ado, Mark, shall we start?
Yeah, brilliant. Thanks very much for that introduction. So yes, we'll be talking about mental health this evening. Say if you do have any questions, throw them in that chat and we can go through those at the end with you and answer to the best of our ability. So mental health. I'm going to start actually with the red right at the bottom there, because this is such a big thing now. It's part of everyone's lives, and we've done a really good job of bringing it a little bit more mainstream. But we do all have mental health. It just happens to be whether it is good or poor, and it's working through that slide to make sure that we are having the best tools available to be able to then, help improve that area. So as you can see with this slide, 3/4 of suicides are men, and it's the biggest cause in death in men under the age of 50 years old. Now, this figure could be high because men are more likely to take their life by extreme measures, such things as hangings or being in front of a train, as where the case seems to be that women are more likely to take tablets, which obviously allows for a little bit more time for them to be found and saved. So this is huge, and I've had a lot of personal experience with this one myself. Certainly with my brother, very much struggled with this, and it's having the difficulty to speak to others about their worries or problems, and it's generally because of the way we've all been brought up. this is getting better, but we're still a long way off where we need to be. And it's still very much a, men shouldn't cry. We don't show weakness. It needs to be masculine. And we're starting to turn that tide with things like the men's club, which I'll come on to later. It's having those people to talk to and go through those issues, problems, as much as you possibly can. So we're going to look at a couple of areas of mental health. Stress. So stress is the body's normal response to protect and support us. When this happens, hormones are released into the bloodstream that prepare us for an emergency situation, such as fight or flight, which I'm sure most of you would have heard that term before. Now, once that stressful situation ends, there should be signals to switch off that body's response. Now, if we can't do that, that's when it can become detrimental to our health. So an ongoing stress and releasing those hormones. We have noticed that health problems due to work-related stress account for 1/3 of all incidents of ill health at work, and around 12.2 million working days are lost each year due to stress, depression, or anxiety. With depression, between 4 and 10% of people globally will experience major depression during their lifetime. And the UK specifically, major depression is seen in around 5 and 10% of people. Now, roughly 2/3 of adults will experience depression symptoms of sufficient severity to cause detrimental effect on their health and well-being. Quite often described as a black cloud hanging over you. It's really not just about feeling a little bit down. It's a real having no interest or an inability to find enjoyment in things that you normally would or that you would consider ordinary. Or you may be struggling to get out of bed and perform daily tasks. Even things, brushing your teeth, cleaning the house, going to work. Real small things that we would consider normal become a real upheaval, real hard work. You may notice some of these if you've experienced yourselves. So maybe a continuous depressed mood. You just can't shift yourself from underneath that cloud. Feelings of hopelessness and helplessness. Really low self-esteem. Tearfulness and feelings of guilt. If you've had these before or you're going through them now, please do reach out. And even just sometimes having that someone to talk to, voice your concern, having someone listen will make a big difference here. So if you are feeling any of these, please do reach out. Physically, slowed movement or speech, a change in appetite or weight, constipation, unexplained aches or pains. Social symptoms, these are quite often the ones where your friends and family may notice a lot more. So maybe you're not performing as well at work as you were, or your studies. Withdrawing yourself from social activities, no longer taking part, and reduced hobbies and interests in your life, things that you would normally get enjoyment out of that you have just stopped getting that sort of feeling from. With anxiety, this can be described as feeling worried or frightened. And these symptoms can be really vast, okay? So very, very mild and very severe. And it's almost like, let's say, blowing a situation out of all proportion. But you're not able to control it. It's really feeling, say, that worried and frightened feeling. So one of the main symptoms, one that everyone we're familiar with, would be the panic attacks, which can be, again, so frightening. And more often than not, I've seen this a lot in my previous work with being a paramedic, can be mistaken for heart attacks. So it's a very, very frightening situation. Two of the common disorders, which again, you've probably heard these terms before. So post-traumatic stress disorder, PTSD, and obsessive compulsive disorder, OCD, can be quite common with anxiety. Phobias and acute stress disorders. And in the end, anxiety is considered an emotional state. Risk factors with anxiety. So gender-wise, we're looking at more women seem to suffer with anxiety than men. The menopause, women can become anxious at this stage of their lives. Now, family history can also play a very big part here, okay? So it's an increased likelihood that a person will develop anxiety if it's got that family history element to it. And this one, again, very big, probably the most common one in terms of what people would associate this with is traumatic events. So it can be caused by trauma, which includes, but not an exhaustive list, of bereavement, divorce, changing job, can make this all much worse under this period of stress. So what can we do? If you are finding it hard in any of these sort of topics or things that we've brought up today, and we'll further on in these slides, first point of contact should be your GP, and they will be able to signpost you to many different options and organisations, some of which we've listed here in this slide. So Minding Hearts, we have a crisis cafe here as well at Stevenage Leisure Centre, Talking Therapies, and the Samaritans. Something you can look at for yourself. This is something that actually helped me a great deal, and something that I'd never really heard of before a few years ago was mindfulness sessions. Now you can go to groups, courses, and do this in a very, I want to say formal setting, but they say they are very relaxed and laid back. Or if you would prefer, there are loads of these mindfulness sessions that you can look at online, just to work on your breathing, help anchor you to a much more calm and stable place. Highly recommend that you do a little bit of looking online at what mindful sessions are available. Use them myself still every day. Really, really, really useful. Being more physically active. I'll come on to again how beneficial that is in a couple of slides. And healthy eating. The way food and drink affects our general state of well-being. The body's physiology is it's outstanding. It can't be underestimated. What we're putting in our bodies really does affect the way the brain works and general mood. And again, we'll come on to this in a little bit more detail. So exercise. During exercise or during stress fats are released into the bloodstream, which over time will contribute to the narrowing of our arteries, which is one of the main causes for angina, heart attacks, and strokes. Very, very big conditions. Now, during physical activity, your body releases other hormones which can help disperse this. Okay, so even as something as going for walks, it doesn't always have to be what you would maybe associate with hard gym training. Going for walks, gardening, cleaning, any of these things will contribute to or to be under that umbrella term of exercise or activity. Now, regular activity will helps to keep the cardiovascular system efficient and working well. So again, trying to restrict or stop the narrowing of the arteries. It can be a welcome distraction if you can find an activity that you do enjoy, where that's then all you focus on for that period of time. Over time, can have a very positive effect on your self-image because you will start to feel fitter, stronger, which helps with that, say, how you perceive yourself. Increases blood flow to the brain. will make you makes you think sharper, think clearer. Stimulates our nervous system and stimulates our lymphatic system. Okay, so the effects of exercise and your general well-being, again, can really not be underestimated. I say it doesn't always have to be gym workouts. We just need to find something that you enjoy. Exercise, again, can be very sociable depending on what sort of thing you like to do. I've always been a big sports fan. As I've got a little bit older, I've moved more into the gym. So I regular training partners that I like to work out with. Some of those are group training sessions. So you could do something in a class studio, or as you can see from the next two options, things like dance classes, football. We've had a huge rise in sports such as pickleball and paddle, which are kind of really open to everybody. We have a wide range of ages in those sort of classes, from younger adults all the way through to, I think our oldest member of the pickleball team is about 93 at the moment. So it's a real open opportunity just to come along, have a bit of fun, meet some people, get active. There's an increase in a morphine-like substance found in the bloodstream, jogger's high, sometimes it's referred to. It's almost a kind of a shot of adrenaline or endorphins, and it acts as an antidepressant. So just by getting out and doing some of these things will give you a kind of, it's almost an internal chemical boost, which makes you feel better. Now, diet's a huge one. Healthy eating, and unhealthy diets, as much as healthy ones benefit, unhealthy ones can really lead to alterations in the brain's chemistry, including the production of neurotransmitters, which help to calm the nervous system. This can also be affected by high sugar and saturated fat consumption. Again, it's something you notice if it's certainly with children. You know, you give them high sugar and they go absolutely, they run ragged for God knows how long, and then there's a huge crash. So it's maintaining those level amounts of sugar within your system, not all sugar, is completely out of the question. You don't have to become an Olympic athlete to have a good diet. It's just having these things in moderation. But diets high in sugar, trans and saturated fats, processed foods that can promote inflammation within the body and the brain. Low levels of vitamin D and B vitamins, magnesium, zinc, omega-3 fatty acid access, and negatively impact the brain function and increase the risk of poor mental health. Eating simple carbs and sugars can lead to rapid sugar spikes and crashes, which can cause mood swings, irritability, fatigue, and difficulty concentrating. Sorry. Alcohol. Initially, alcohol may seem like it can cause or help with relaxation, and that very much is the case. Unfortunately, it is only temporary. So once the initial effects of the alcohol have worn off, it can lead to the things that we are trying to avoid here, which is increased stress and anxiety, and increased depression, as alcohol is a depressant and would make a pre-existing condition worse. It can cause huge disruptions in your sleep pattern. So although you may have a drink and initially feel tired and want to go to sleep, it's more often than not, you will then have a very disrupted sleep. So you'll wake several times within the evening. Thus the body really struggling to reach your REM sleep. So you're not fully relaxed or rested by the time you wake up in the morning. If there's an existing mental health condition, alcohol can exacerbate that, and symptoms, it will make any of those treatments less effective. And without saying, relying on alcohol as a tool in terms of trying to make yourself more relaxed and better can lead to addiction. And again, just really piles onto the problem. and it will make the situation much worse. If you are going to, again, you don't have to become teetotal. That's not what we're asking or not what we're saying. Keep an eye on your measures. You can always do things like the tip of the top, which is use a smaller glass. Of course, celebrate a good day or commiserate a bad one, but try something else other than alcohol sometimes. So go to the gym, go for a walk, do a puzzle, something that's a distraction, and ideally something again that is going to be a little bit social. Yeah, even if it's going for a walk with one person. We have loads of walk groups around the area now, again, which is, we just meet up, we will go for a walk, an hour or so, and you just talk absolute nonsense, really, and try and enjoy yourself. Random jokes. It's just nice to be around people. Try not to keep alcohol in the house. Certainly if it's starting to become a problem as well. If it's not there, you can't drink it. In terms of, again, the body chemistry, how you look at yourself, self-esteem, alcohol is also calories. So on top of what you've been consuming in terms of your food for fuel, the alcohol will pile on calories and again can lead to other health and medical issues, as well as that perception of yourself and maybe a little bit of lowering that self-esteem again. Several organisations that you can see listed where you can get that help. Again, as with anything that I'll mention, first place to speak would be your GP. And then there are various organisations, if it's a drug issue, an alcohol issue, mental health issue. We have Frank, Change for Life, Al-Anon and Samaritans, Drinkaware and Mind. But if you speak to your GP, they can help guide you to what would be best suited to try and help you progress along the mental health issue that we're having. Mindfulness, mentioned it earlier on, really, really good. And I really can't, it's just done me the world of good. I had a very high stress job previously, and a brother was suffering in a big way with mental health. And this really helps. I'm very much an early bird. I mean, it helped. I have 3 children under the age of 6, so getting up early isn't always my choice, but it's something that always happens. And I start my day with mindfulness. I normally put my coffee on, and while that's getting ready and percolating, I'll do a 10 to 15-minute mindfulness session, guided by a couple of apps that I like to use. So please have a look, see if it's something for you. It won't be for everybody, but it's done wonders for me. I can't recommend it enough. So it's very much an art. People may try it and fail to do it the first time, and then just kind of give up. So try a few, give yourself a couple of weeks of trying something like this. Like all other things, some people take to relaxation quickly, so where others do find that difficult to switch off. Stress hormones suppress the immune response, and relaxation allows the immune system to recover and function more efficiently. So it's doing so much for your body if you can get yourself into that state where you are relaxed, breathing at a nice pace, and able to take yourself away a little bit, but at the same time becoming a little more present within yourself. Relaxation helps lower blood pressure, which again will reduce the risk that we can all have of strokes and heart attacks. And relaxation gives you a time out. It lowers activity within the limbic system of the brain and the emotional center. It gives you a break from whatever is going on, time to focus on you, which is hugely important. And as mentioned at the start, we do have some men's clubs that we run over all areas of Hart. So Stevenage, Hitchin, Royston, Letchworth. we'll advertise them within our social media pages once we get those running, and they go into, say, a great deal more depth of what we've kind of spoke about here today. We do them over 4 weeks. So we would look at matters of the mind on week 1. We then really delve into nutrition and the healthy food options that we should be looking at. Week 3, particular health problems, certainly that mainly relate to men, and how we can start to notice those, what we can do to help try and prevent those or recover from those, should those have happened to you previously. And then looking after the back, our posture, lifestyle advice. We'll give you some, say, gym and training advice. If that's something you're looking at doing, and kind of anything else and in between. The sessions normally last around 2 hours, and it's just people all from similar backgrounds, also had similar issues. It's very it's confidential. We don't share any of the information, and we can just all have a good chat. And again, we quite often end up quite a close-knit group come the end of the 4 weeks. And then we come to any questions. I don't know if there's any in the group at all.
Thank you, Mark. That was great. I mean, I know I'm not a man, so this isn't really necessarily aimed at me, but I have to say so much of what you said is so relevant to me anyway. When I think about, going to the gym and the motivation, I have a friend who I run with once a week, and she wasn't available this week, and I still went, but I didn't run as far, and I didn't,
Yeah.
and I just got exhausted and stopped and walked home.
Yes.
And actually, when you've got something that you're doing with a group of people, or even just one other person, sometimes that can really motivate you. Some people are brilliant at motivating themselves, aren't they?
Yeah.
But for other people, having a group that you can do things with, it's much more difficult to decide not to do it if other people are relying on you, particularly if it's a kind of group thing or something like squash or tennis where there's only
Yes.
one of you. That's quite important, isn't it? I think that, I mean, there aren't actually, maybe there are some questions now. Let me just pull this up. There's a question about whether the men's club is online only, and actually I believe it isn't. It's face to face, isn't it?
It's face to face. Yes, we would meet at one of the various centres. The different centres do different days, but yeah, for example, we'd meet on a Monday evening at say Hitchin outdoor pool. They've got a nice meeting room over the back. We're there. We have tea and coffee, and we have a good chat face to face for the 2 hours.
And how do you can you just self-refer to that, Mark?
Yes, you can. Yeah. So once we start advertising, we'll send out again information on how you do that. But it really is as simple a case as either emailing us back or phoning us up. We'll take your details, and you're on the list. So you can, yes, very much self-refer.
And how many people do you have in the groups?
So we normally go up to 10 to 12, just so that we can give everybody as much personal attention as we possibly can. And certainly as the weeks, certainly after the first week that goes by, weeks 2, 3, and 4, everyone kind of knows each other. So there's a good chat, and it goes on for a good 2 hours normally. It becomes a really nice social option to kind of discuss your problems.
Brilliant. And maybe somebody you could go and do some exercise with. We've got another
Most
question,
definitely.
which is what time are these? What time are these usually on? And what day of the week, I guess, is another question.
Yeah, so the days of the week vary from what we've been doing so far this year. They've normally run over, either, depending on the centre, Monday, Tuesday, or Wednesday evening, from 7 p.m. till 9 p.m.
So hopefully fits in with people's work, that kind of thing.
I mean, and we're also flexible on that, So if we get a demand that's either daytime or weekends, then we do move things around. It's very much decided on the amount of people that want to join the group.
Brilliant. I think what's really key, and you said this at the very beginning, is talking about it, isn't it? Because men are traditionally not so great at coming along to talk to anybody about these sorts of things. And you know, I hope that your GP would be really wanting to talk to anybody who was feeling low. As Mark says, there are lots of options that we can support with. Lifestyle is where we would start. Some people need a lot more support than that. And Mark mentioned the Samaritans and various helplines. And actually, if anybody's really in a crisis and struggling, there's a new mental health urgent treatment centre opened at the Lister. So in a real dire situation, it's actually, I've not been there myself, but I have heard about how the environment there is much better than turning up to A&E, because it's much calmer, and actually all they deal with is mental health problems. So if you're in a real pickle, then that would be a good place to know about, because I don't think it's been necessarily very well publicised just to the general public. Hopefully not too many of you at that point, and making lifestyle changes can be massively beneficial, particularly as Mark mentions, you know, diet, exercise and alcohol. We all think, oh great, glass of wine, that'll relax us, and actually maybe not doing what you hope. We've got another question, which is the club for men of all ages?
Yes, yeah, again, very, very much so. Yeah, any age at all, really. So yeah, my last group that I did over at Hitchin, I had one young guy who was 19, and the eldest in that particular group was 75. So it really is a full range, and it's still amazing how much we all have in common. You know, that we all having very similar struggles. So yeah, very much any age group, please come along.
Super. Now we've got another question, which is, could you explain a little bit more about mindfulness and what that actually entails?
Yeah, certainly. So I suppose maybe a phrase more common or more heard of is similar to meditation, I suppose, would be between meditation and breath work. So it's being able to almost say take yourself away from your current situation by controlling your breathing, using visualization, and just by bringing those sort of you're bringing your heart rate down, you become more relaxed. It's a very body's natural way of getting you back to a relaxed state. Like I said, I've tried loads of different ones online. Just gone onto YouTube and done various research on various practitioners of mindfulness. But yeah, I suppose maybe very similar to meditation would be a more recognizable term.
It's kind of about bringing yourself into the present, isn't it? And
Yeah.
being really aware of what you're thinking and what you're feeling. And I have to be honest, I'm not very good at practicing mindfulness, and I know I should do it more. But I remember one a kind of a it was on an app or a podcast or something, and you were supposed to get a raisin and really focus on the raisin and all of the kind of, you know, the dents in it and the colour of it and the size of it, which sounds ridiculous, but if you're really focused on that, you stop thinking about all the other things that are going on. And the wrinkles in a raisin are fairly, you're not going to get upset about the wrinkles in a raisin, are you? So
No, true.
Yeah. But yeah, the breathing awareness, and I'm sure all of you have heard, you know, if somebody's having a panic attack, everybody says breathe, breathe, big breath in, big breath out, and it sort of encompasses that a little bit too, I think.
Yeah, so it's almost a deliberate distraction away from what the problem is. So yeah, we use various. I mean, some things don't get used anymore. That I think people used to breathe into brown paper bags and counting.
It doesn't have to be a brown paper bag, Mark, but we do still breathe into bags because the rebreathing makes you breathe in carbon dioxide. And that's
Yes, it. Yeah. But yeah, square breathing. We count numbers: 4 in, 4 out, 4 holds. Again, then the number again. It's just a welcome part of the distraction to help calm you down and regulate the breathing levels.
Absolutely. I think something maybe we didn't touch on is, I think people often, with whether it's mindfulness, I'm very guilty of this, or whether it's exercise, people often say, I just haven't got time. When am I going to fit this into my busy schedule? And and I wouldn't want to suggest everybody does this, but when I get a report from my phone about how long I've spent on my phone screen, it does make me realise that if I had maybe prioritised a bit better, I probably would have had time to do a bit more exercise.
Yeah, no, that's alarms on phones or smartwatches can be great for this. So again, it makes a huge difference. Even if you were to get up every, I think it's between 30 and 40 minutes and do a minute's worth of activity. So whether that's walking up and down on the spot while you're making a cup of tea, or you'll stand up and do maybe just some standing squats. So it's not, doesn't have to be an hour or 2 hours at the gym. It's just not staying in a sedentary seated or laying position for hours upon end. Which you go, don't get me wrong, I've watched my share of Netflix documentaries or binged a series, but by having that reminder, go off on your phone or watch, just to get up, move around for 60 seconds, do something, then come back to doing what you were doing. Even that would be a great starting point. Certainly over doing nothing. It makes a huge difference.
Absolutely. And there are, of course, lots of organised activities that you can join in for free. I mean, there are park runs, lots of park runs. There's one in Letchworth, and you don't have, I mean, it's called Park Run, but you don't have to run it. In fact, they have a tail walker. You can go as slowly as you like. And they do sometimes run kind of, I think, like couch to 5K programs as well, with some of the park runs as well, to get you going as well. It's a really nice community.
Yeah, I've done a few of the local park runs. I quite often drag my little 6-year-old along to the adult ones now. Bless her, not always very keen, but she'll come. But like you said, it's not a race. It's not serious. It's generally a very welcome, open community. Run it, walk it. Again, it just gives you an opportunity to be outside, be moving, and I guarantee you will meet some nice people.
Yeah, and all the park runs start at 9 o'clock on Saturday mornings,
Correct.
wherever you're going. The one in Letchworth starts over on the Grange. I don't think there is one in Hitchin. There's one in Stevenage at Fallon's Valley, I believe.
Yes, correct. Yeah, Fallon's Valley Park. Yeah.
Yeah, so also helpful. I mean, we have still got 20 minutes or so. If anybody's got any other questions, please do pop them in the chat. But otherwise, unless there's anything else you wanted to add, Mark. I think what I know this is, we haven't touched on this, but obviously there are because it's very medical, there are medications that are available for depression, and for some people that's really beneficial. So again, all of these are very sensible things that you can do to try and improve your own mental health without thinking about medication, but for some people that is what's needed. Obviously, for sometimes, I mean, we all feel a bit low and anxious sometimes, so we don't want to medicalize everything. But if it is really, if it's affecting your life, come and talk to your GP so that we can go through the options with you. And in terms of talking therapies, we're really lucky locally, because not only do we have access to talking therapies like counselling, but the GPs in Hitchin and Whitwell Primary Care Network, we also have access to a coaching service, which is slightly different, and that's about goal setting more than looking. I sort of see counselling a little bit as looking backwards and thinking about what happened and how you can move forwards, whereas the coaching is more about setting goals and how are you going to achieve them, rather than digging into the past. And I think some people find that a more helpful approach, and your GP will be able to signpost you to that as well.
Brilliant.
Sorry, I started asking if you had anything else, Mark, and then I jumped in myself.
No, nothing else really there to add, other than say, any questions about any of the facilities that we hold in the area, please get in contact. Again, there's no high pressure here to force you into buying memberships and that sort of thing. But if you want to come and have a look, have a chat, we're more than happy to do that, show you around, and then we can explore if it is something that you want to do, or we can look at signposting you to other directions, just to get you, say, active, moving and meeting people.
Brilliant. Now, Dion, maybe Mark, can you remind me what the next session is, which will be And the date, actually, that would also be useful. I think it's all of them are on the second Thursday of the month, I believe, Dion.
It is the nutrition and diabetes next month, and yes, they are the second Thursday of every month. So the next one is the 9th of October.
Yeah.
Brilliant. So we hope to see you on the 9th of October. These sessions are open to anyone who's interested, be that patients, our patients or not our patients, because all of this information is relevant to any men, and we aren't, you know, they may not be able to access a coaching service, but they are able to, you know, benefit from all of this education. So if you've got friends or relatives, where even, you know, if there are some women around who want to know a bit more about their men's health for their partners or sons and fathers or whoever it is, then please do encourage them to come along. Thank you very much, everyone. Have a good
Cheers,
evening.
all. Thank you very much for coming.